Hi, I'm Neveen, spelled with 3 E's. I grew up in a small town in New Hampshire, and one time I showed up in 5th grade, and my friend Lizzie had this cool mug on that said Lizzie on it. So I went home, grabbed my allowance, biked to the local dime store, the off-price outlet, and I went to get a mug that said Neveen on it, spelled with 3 E's. I walked into the store, headed to the mug section, looked at the ends. Nancy, Natalie, Nathan, no Neveen. Could they be sold out? I went to another store, same story. Wait, do they not make a mug that says Neveen on it with 3 E's? This is devastating as a 10-year-old girl. Back then, way back then, personalizing anything at scale was a challenge, but technology has come a long way. Now I can print a mug that says whatever I want on it and have it shipped to my door in 72 hours or less. We expect everything in our life to be personalized, especially the important things, like our healthcare. I'm a managing director and partner at the Boston Consulting Group. I live at the intersection of technology, healthcare, and equity. And I like to think about, how do we use technology so that everyone has more healthy days in their life? And this is a super exciting time to think about that, because we're at this collision of technology innovations. Biotechnology is evolving at a super rapid clip. Gen AI is so accessible. I used ChatGPT to figure out where to get sushi last night. AI and machine learning is creating laser-focused insights based on broad data sets. And we are all connected through this ecosystem of smartwatches. We wear smart rings. We drive smart cars. We sleep in smart beds. We're really smart. And we are creating so many smart innovations. We can predict breast cancer 5 years ahead of time from a speck on a scan. We can use generative biology to create medicine for rare diseases in a fraction of the time and the cost that it used to be. We can create wildly personalized healthcare experiences that are unique to your specific physiology. So what's the challenge? The challenge is that most of us are not really reaping the benefits of this personalized healthcare. I mean, I don't know about you, but the last time I went to the hospital, it didn't feel very personalized. I must have been asked the same question like 11 times. So why is that? It's not a matter of the technology. It's not a matter of the innovation. I'm here today to tell you that it's a matter of the people. It's a matter of you. It's a matter of me. But don't get up and leave yet, because we can redeem ourselves. We just need to make a decision that we want everyone to have personalized healthcare and healthier days. And then we need to take actions relative to that decision from day one. Let's make this real. Let's talk about an example. Let's talk about a medical device that was made by 2 different companies. One that set a vision to address a broad population, the other, less so. This is a pulse oximeter. It measures the oxygen level in your blood. It was used in the early days of COVID to estimate how sick you were. Sounds simple enough, right? And great, by the way. It's credited for saving thousands of lives. So what's the rub? Well, the rub is it overestimates the oxygen level for people with darker skin tones. So let me play this out for you. So a Black person would walk into the hospital in the early days of COVID struggling to breathe. You could hear them struggling to breathe. And they'd get triaged into the ER, and they would get a pulse oximeter test. And then the doctor would look at the results of the test and say, "Great news. The oxygen level in your blood is healthy. You're fine. You're fine. You're fine. Go home, rest." But they were actually really sick. In fact, according to one study, Black patients were less likely to get hospitalized, less likely to get oxygen treatment at all, And if they were lucky enough to get oxygen treatment, they had to wait on average 4.6 hours longer to get that oxygen treatment. How did we get here? We got here because nowhere along the journey of development to testing that pulse oximeter device was a broader population considered. The irony is, another company did consider a broad population in developing a pulse oximeter. In the 60s and 70s, HP and NASA partnered to create a pulse oximeter for astronauts. And anyone that's seen the movie Apollo 13 knows the vital role that oxygen plays in space. I love that scene when they're trying to get the square peg into the round hole so they'll have enough oxygen to get back to Earth in time. So HP had no idea who would be the future astronaut. So they had to ensure that this pulse oximeter would work for no matter who those astronauts could be. So they set a vision that this would address a broad population. And that vision made it so that they did 3 things differently with their design and approach. 1, they used 8 light sensors instead of 2. 2, they consciously tested on a broad population that included 248 Black patients. 3, they allowed the device to be calibrated according to how your skin absorbed light by taking a prick of blood from your ear. Same device, different vision, different approach. It wasn't a matter of the technology. It wasn't a matter of the time. It was a matter of making an explicit decision to make the pulse oximeter as inclusive and personalized as possible. We need to set a bold vision that everyone gets to take part in personalized healthcare that is as inclusive and personalized as possible. In COVID, my team and I worked on another challenge, and that was that, let's just face it, nobody wanted to go to the hospital or the doctor during COVID if you did not have to. But there are people with chronic conditions that need to go on a regular basis for appointments, for procedures, and they weren't going. So my team and I used a machine learning algorithm to predict who was most at risk of having an emergency. And we sent them in a nudge, like an email or text, similar to the text I sent my kids this morning, like get up, go to school, I know mom's not home, but go. And this nudge basically said, okay, you've missed this set of appointments, so specific to each individual. You've missed this set of appointments. This is the risk. Please go. These are the safety precautions you can take. And some people went. But just like my text to my 3 kids, and 2 got up and 1, needed a little more, when we started to listen and learn from the patients, we realized there was a factor that we didn't consider, and that was cost. Now remember, this was the early days of COVID. A lot of us weren't working, or we were working much less. Out-of-pocket costs were a factor. So we revised the personalized content that we were sending to include a very specific estimate of the out-of-pocket costs that an individual person would have to spend in order to do their appointments and procedures. Our vision was that if you give a person the specific information relevant to their unique physiology and situation, they can make the best decision for their own health. And guess what? It wasn't more costly, it wasn't more challenging, it wasn't more complex, but it was more effective. Because we made the decision from the get-go to use the technology for as personalized a solution as possible for everyone. No matter what they looked like, no matter where they came from, no matter how much money they made. Everyone. This big and bold vision directed the actions we took every day. So let's jump in with both feet from the get-go, whether we're making a personalized app sending a personalized nudge, making a medical device, or creating a mug that says Neveen on it with 3 E's. Thank you.